Can you discuss what part, if any, differences in ethnicity, cultural background, language, and literacy between patients and practitioners may play in supporting or discouraging clinicians to engage in discussion of sexual risk reduction with HIV-infected patients?
Well, I think that the factors that you mentioned actually have a big part in the sense that for clinicians, it's difficult to talk about sex and therefore to talk about how to reduce the risk of transmission of HIV or other sexually transmitted diseases as it is. It gets into topics that clinicians find difficult to deal with. And then if you have a patient, say in terms of language, if you have a patient who doesn't speak English and you don't speak that patient's language, it's very difficult to have a discussion about very sensitive issues. And then you probably have to have a translator in the room, which really shuts down communication. In terms of cultural background, unless you understand where the person is coming from in terms of their attitude towards different types of sexual practices, or whether they can even discuss sexual practices, that would clearly be an issue. And for instance, what I have found, just not to pick on any particular ethnicity or background, but I've taken care of many Latino women. And in many cultures, Latino women really are guided by their husbands, and their husbands make their decisions, or their partners make their decisions for them. And they are very reluctant to discuss sex in general. And then when you have the husband in the room and you're trying to talk to the woman, because she's your patient, about how to reduce the risk of transmission, and then you have the partner in the room, it makes it very difficult, especially when you have the woman looking at the partner saying, you talk about it. So those are just a couple of examples that point out that when you're talking about a sensitive issue to the patient and to yourself, you really have to be very sensitive to a lot of other context, and that can put a barrier in and make it less likely that you are going to even broach that subject.